So what we are going to do is anatomy, how we see it on the word. On that is how we write. We are going to look at the structure of the left ventricle, because remember I was telling you it is the most important part. All other parts are important, but left ventricle is so important that it's supposed to be assessed. We assess all other things, but left ventricle should be assessed very well. So we are going to see how we can divide it. It is going to be divided in many segments. It's going to be divided in many segments. So we are going to look at the 17 segments left ventricle, the 17 segment model of left ventricle. Remember, I've been telling you that short axis, you know, you hear we are talking of posterior wall. What is posterior wall? But remember, we have anterior, depending on how we see, anterior and posterior. If we have posterior wall, it means we have anterior wall also. We have the lateral side. Remember what I was telling you, that the heart is 3D. That is the most important thing you shouldn't forget. It is 3D. We have the anterior, posterior. For example, if I draw here, this is myocardium. Yes. And this is mitral valve. Have you seen something like this? Yes. This is short axis at the level of mitral valve. So it will be opening like so simple. So we have anterior side and posterior side. This is the anterior aspect. Yes, this is the sector. Meaning this is the anterior part, anterior aspect, this is the posterior aspect or inferior. So what you should know, we have anterior and inferior, lateral, medial, and the medial part. But the medial part will not be all that much important. Remember also, we said that they will have the septum, the septum. So what we actually see on the heart, we have this, correct? This is anterior, and this one we are going to call it inferior. Anterior, 3D. Why is it inferior? It is 3D. The heart is like this. Yes. You do the probe, this is LV. You put the probe here, you are seeing the anterior part, but what is below is inferior. Yes. You assess superior and inferior, but not like that. This is anterior, inferior. This side you have left to right ventricle. And what separates the right ventricle from left ventricle is the ventricular septum. So here we have the septum. Anterior, septum, inferior, and then the other side, lateral. 3D. Again, if this is RV, here, RV, it is separated left ventricle this side. In the middle here we have interventricular septum. Yes. Then down here, interventricular septum, this side the flow is inferior. And then up here we have anterior, this side we have lateral side. Again, from here, for this side we have right ventricle, this side. This is a simplified diagram.
This is short
Very
axis.
simplified, yes, short axis. This side we are supposed to have right ventricle. Right ventricle we have. This is very simplified.
Short axis with a pointer pointing to the left.
Yes, left. This is a transverse cut. So we have septum here. If this is RV, this is LV. Yeah, this is interventricular septum. This is the anterior aspect of left ventricle. We are on left ventricle, not right ventricle. So we have to see the septum for as it borders right ventricle and left ventricle. And then we have the inferior part. And then the lateral part.
Okay.
I don't know if you it is a bit confusing for now. But just remember, from the views we did parasternal long axis.
Parasternal long axis where we is it?
There's the one where we have don't mind. You don't mind the interaction. Parasternal long axis. Parasternal long axis is this one, where we had
parasternal long axis where we're measuring the aortic.
This was the aortic valve.
Yes.
And this was mitral valve.
Then the right atrium.
The left atrium.
Sorry, the left atrium.
This is RV, interventricular septum. And then posterior wall.
Yes, posterior wall. And then the left is.
So this is parasternal long axis. Now we say from there you turn the marker to the left shoulder. This was when the probe marker is on the right shoulder.
Yes.
Now when you turn the marker to the left shoulder, say you go for transverse cuts. And transverse cuts can be...
This is first with the right.
Right.
Marker to the right shoulder.
Then from there I went to transverse cuts. Transverse cuts, they are these ones, short axis with fuse, yeah? Now there are short forms here, we can call it short axis, parasternal short axis. This one is plaques, eh?
Parasternal
long axis. That's how we shorten them. Right? So this there views short axis, and we see the different parts on echo. We are going to divide. I've told you, like, the left ventricle is the most important. All others are important, but left ventricle will put more emphasis on it. Why? Because it supplies
the whole body.
The whole body. Since we put more emphasis on it, we went ahead, all the people who did echo went ahead and divided it into 17 segments. That division was according to, remember we talked about coronary arteries? Coronary arteries supplying the heart.
Yes. And
these segments, they really show like the territories where coronary arteries supply the territories. We know this part It is supplied by wheat and wheat. This one is by wheat coronary arteries. This one
is it the diagonals? Is it
yes. Yes. Remember again, when we were starting, I told you that this heart, it has the base and apex. And we said the base, it is towards the atria. The apex is towards the tip of the ventricles. So if it is towards the atria, the base, normally we don't consider atria. We consider the ventricles. So the base is at this part. This is the basal part of the heart. If I do from plaques, it has the mid part. It has the mid part.
It will measure the cusps.
It can be at the cusp, but this is the basal part. We have something called papillary muscles. So mid part, mid segment, basal segment, mid segment, and then when you go this side towards the end, you find the apex.
Yes.
Oh, yes.
Morning, doctor.
Yes, you pass and sit.
How are we?
Yeah, good. Yes.
Don't go hard on him. Don't go very hard on him.
No, I'm not going hard.
Because the physiology may be difficult.
No, I want to first finish the anatomy as we
The anatomy.
so that if we are understanding whatever we see.
Yeah, whatever we see.
We currently in the anatomy.
To understand what we are talking about, VH or whatever.
So we have the basal part, the mid part, and then the apical part. We divide it into those segments. What is the apex? The basal part, the mid part, and then the apical part. That is the ventricles. And majorly the LV, nothing else we're talking about.
And then we are still at the long axis.
Yes. So this is long axis. Short axis, this is at the level of mitral valve. We simplified it to this. So we also have at the level of papillary muscle, because this is a papillary muscle. We have two papillary muscles from the left side, left ventricle. Remember, we have two cusps of mitral valve here.
Yes.
So these cusps, they have to be supported. If they don't support, if they are not supported, then they can just flip back left atria when the ventricle contract. We don't want that. So they have to be supported by string-like.
Not here is papillary muscle. Is it papillary?
To support the leaflets.
You just have to support the cusps or the leaflets. So papillary muscle
Supports.
then supports. We shall name this one later. We also have another one this side. There are two cusps, so there are two papillary muscles. Not only one is supporting, but we don't see it here in this view. But it also has to support this one. Yeah. Also, so these two, they are papillary muscles. So we have these ones. When we cut in the mid part, this is the basal part, this is anterior leaflet. No, we will say the medial, and then that is posterior. Anterior, posterior. But here we are going to call it anterior or posterior. So when we go to the mid part, midsection, so we have gone now from mitral valve to this side. So we should not see the mitral valve again.
Okay.
So we are just going to draw. We are drawing. And these are the papillary muscles.
Okay.
This is the myocardium. These are the papillary muscles. One papillary muscle is here, another one is here. We have cut it. We are not seeing the mitral valve. Here, this protrusion inside the cavity, it is the papillary muscle. This is at the mid part, mid segment. This is the medial, this is the posterolateral hole. Papillary muscle, and then anteromedial is
particularly the medial one is so important.
yes, very important.
Very important.
As far as if ischemia is there,
Yeah.
then regurgitation. But we shall see that one. But for the first one, this is what we see. At the level of mitral valve, we see it like this. Short axis now. We are talking of short axis. At the level of papillary muscle, we see something like this. And then at the level of apex, here, but we won't see it here. Then we're going to just see something like apex. We have past papillary muscles, so we are not seeing anything much here. You just see something like this. This is LV cavity.
This one is here, right? Then this one is this one.
Yes. So this is what we are going to see. This is at the apical level, apical segment. This is short axis. Very things are there.
Papillary.
This is what we are going to see in short axis. Remember the anterior and posterior. So for the 17 segment, we are going to now go back to anterior, septum, inferior, and lateral. The septum is medial, that's why I wrote here RV. It is the boundary between left ventricle and the right ventricle. So RV is here. Septum, we are going to divide it depending on base, mid, and apex. So if we put, for example, I've cut at the base, at mitral valve, at the base, this one is going to be basso anterior, because anterior continues down. Anterior continues down from the base to apex. So we can cut at the base. We are going to still see the basal part and the anterior part. So, meaning it will be basso anterior, showing that we cut at the base.
But anteriorly.
Yes, but the anterior segment we are seeing. We are seeing the basal part of the anterior segment, and then we are going to see basal part of the mid segment. Like mid part of the anterior segment, mid part of the anterior segment. Then we are going to see, yes, apical part of the anterior segment.
So all those segments will amount to 17.
Yes, they will amount to 17 if we divide them by
And every segment has a significance.
Yes, depending on blood supply. The coronary arteries. Depending on the blood supply, then it is going to be significant. Because one of the ECHO, remember the indications, it was coronary artery disease. So this one shouldn't be too long, so we can even stop here and first internalize these ones. These ones you've been seeing.
Yes, I've been seeing them.
You've been seeing these things.
When I do first investigation with what I've been monitoring, observing, this is how you begin the procedure at the mitral valve. Sorry, you begin at aortic.
We start with this one. I start with plaques.
Yes.
And save it.
I know parasternal long axis, but you at aorta level.
Yeah, I begin, when you see clear, I begin, I make something like this, then save it without putting color, without measuring.
Yes.
I save it.
You normally make a cut here.
Why? Why do I save it? To give first impression. Only seeing this one, I can tell, okay, this patient, this is likely to be a normal study. That's why I save it without applying anything. Next thing, I apply color. I apply color here and apply color here on mitral valve and aortic valve. To see, to give a rough indication whether they will have regurgitation or stenosis or not. After that one, then I can proceed to measurements. I apply a mode and then make measurements. I measure the aorta and left atrium, and then
mitral,
the LV cavity, and then the wall's thickness. I measure. That's where I start from. And then next, when after measuring, I go to
short
this
axis.
This one gave the first sign I saved. It gave a first impression, but now to make sure that actually I see all the segments, then I have to do short axis. When I do short axis, I see everything at the base. If contractility is good all around, then I go to mid part. If contractility is good all around, and then I go to apical part to see if it is contracting very well. If they are all contracting, then I rule out. I can rule out like coronary artery disease or ischemia. Not rule out, but I'm sure there are no wall motion abnormality. Wall motion abnormality meaning one part is contracting well, another one is not contracting well. For example, one time.
The clinical example is a guy who has right coronary artery. So this guy comes in, has been jogging, and he's having chest heaviness or tightness. You see the wall motion abnormality in the median because the RSC supplies
the inferior and the septum.
The septum supplies the medial patellar muscle. And sometimes they say he comes in with intermittent mitral regurgitation because every time he gets angina, boom. And then when you see when there is no angina, they don't hear mama. That's what I was thinking of, that lady that could be. So the women you never can tell.
But no, what motion abnormality was there. Yes. No, I'm having for him. Thank you.
Take our system, not so.
You put.
So he has come for echo for a test.
He did that test yesterday.
Yeah, echo he didn't.
He didn't do echo, it is only remaining. And I think urinalysis. He didn't do urinalysis.
Yes, so I'm going to check whatever he did.
He didn't do urinalysis. So now,
wall motion abnormality we shall see.
Do you observe it?
Yes, well, that one we shall see. But for now, first get these ones.
Yes.
For now, first get this one. Then how to see wall motion abnormality, we shall see. If we receive a patient with one, you'll be able to see actually there is no balance. Okay? One is moving, another one is just there resting.
Relaxing.
Yes, you will see it if we are to receive the patient. First internalize these ones. Now next one I will show you how the real 17 segments. Because for now it may be too much. But just know we are dividing the base If you're seeing the anterior, you can see anterior from the base, you can see anterior from the middle, you can see anterior from the apex. Meaning even the inferior also we have inferior basal, mid inferior, and then apical inferior or inferior apex. Lateral, basal lateral, mid lateral, and then lateral apex or apical lateral.
Okay.
And then septum, basal septum, mid septum, and the apical septum. You see?
Man, you know the anatomy. Oh boy.
So for now we are going to take that one.
Let's first internalize this.
Yes. So whenever there is equal there and I'm doing, then you have to say like, okay, well, this is what we saw, this is what we saw. When you see something like this, capillary muscle.
Now this next patient you are going to see, let me go and see these images.
For now that is done, yeah?